or your partner is a frequent loud snorer, it could be a symptom of a more serious sleep disorder called sleep apnea. Joining us to share more is ear, nose, and throat surgeon, Dr. Daniel Pulaski. Dr. Pulaski, nice to have you here today.
Thanks for having me.
I will admit I do snore. It's wonderful to have you here to offer advice, but snoring doesn't necessarily mean that you have sleep apnea. Tell us exactly what sleep apnea is.
That's right. So the sleep apnea is the breathing cycle is disrupted for any number of reasons, but most commonly something is blocking off the breathing passageways. In small kids, it's usually big tonsils or adenoid tissue in the back of the nose, but in adults, it could very well be something in the nose or behind the nose or even in the throat, very commonly the back of the tongue.
So just because you are a snorer doesn't necessarily mean that you have sleep apnea. What are some symptoms that may actually say to you, I should get checked because I may have this disorder?
Sure. So usually the bed partner will notice that your breathing pattern has pauses in it, lasting 10 seconds or longer than that. So you may hear the snoring and snoring and snoring and then a nice long pause that then brings it to their awareness and they get a little nervous about your breathing. Also, when the person who has sleep apnea would wake up in the morning, many times they had morning headaches, tired in the afternoon, a lot of fatigue. These kind of changes will happen that they'll notice a lot, falling asleep while driving. These things are pretty dangerous too. Not just there are things that they feel on a daily basis, but chronic things too. High blood pressure, increased risk for strokes, increased risk for reflux or stomach acid, indigestion, weight gain. These things all change the body based on their sleep.
Now, can this be dangerous?
Absolutely. Like I said, falling asleep while driving, pretty dangerous stuff. Strokes, a lot of morbidity and terrible outcomes come from untreated sleep apnea.
Now, what is actually happening when your bed partner does notice that you're snoring and then there is that long pause? Do you stop breathing during that time?
Yeah, so the breathing, the air isn't moving through, and so it's being held up. Their body wants to breathe. It's usually going through the motions. The muscles are working to try to help them breathe, but something is blocking it off, and so the air isn't moving and the blood in the body isn't getting new oxygen. That puts a lot of strain on the heart and the brain, which need the oxygen.
Makes perfect sense, but there are treatment options available. Tell us about how this can be treated.
Sure. So one of the first line treatments is to figure out what's going on. Get an idea of what risks you have: high blood pressure, diabetes, heart problems in general. Then after that, a sleep study can help define your breathing pattern through the night. So an observation where we're seeing what the breathing pattern is. Beyond that, sleep apnea can be treated with CPAP, but I also have surgical techniques to help with sleep apnea. Now
tell us more about that surgical procedure.
Sure. So there are some new surgical procedures which have become available because of a surgical robot called the Da Vinci, and I'm trained to do that. This surgery helps people breathe by changing the anatomy in the back part of their throat.
Now, we're looking at a photo right now, and that's you. And are you standing right next to the Da Vinci robot?
That's right. So the Da Vinci robot has two parts. One is a console where I'll actually be sitting. That part that you're looking at there is the part that I'll change into position to be near the patient's mouth.
So tell me about this procedure. If you do find that someone who does have sleep apnea, they're a perfect candidate to get this procedure done, what is it required? What is the follow-up like?
Sure. So the patient would come with me to the operating room. I would position the robot and have an assistant there helping me use some of the instruments, and I would use that robot, the tiny little instruments, in a very small space to look around the corner, if you will, behind the tongue, and I position the camera in a certain way that I can see the structures and what's going on, what's blocking things off, and then I can use the instruments to help change the shape of it to make more air pass it.
Oh my goodness.
The patient usually stays for a couple of days while they're recovering, goes home, and we reevaluate how their breathing is, and they notice an improvement.
Wow, and it's been, I mean, people have really noticed a difference in their quality of life, right?
Yeah,
because they're sleeping, and not just their quality of life, but their bed partner as well.
Exactly. The joke is that they return to the bedroom. Oftentimes they're on the couch, they're in the basement, they're not where they want to be.
I mean, we laugh about it because it is, you know, snoring is kind of a funny thing, but it's really something that's serious, and it does really kind of get in the way of relationships and sleep.
And it's very common, too. Absolutely.
Yes, for sure. Now, this Da Vinci robot is something that is available that you use at Ear, Nose, and Throat Surgeons of Western New England. Tell us how people can get in touch with you.
Sure. We have a website, out there on the screen, entsurgeons.us. You can use that to help make an appointment. Give us a call in the office or come to the office, and we're happy to see you there. I do an evaluation in the office where I take a look at your anatomy, talk about the risk factors that you have and what symptoms you're really having that I can help you with.
Right, so if you're snoring, it's worth going to see you and find out if it's something that you can benefit from. And you might as well, because we all deserve to have a good quality of life and a good night's sleep.
I think so.
Right. Thank you so much, Dr. Daniel Pulaski. Nice to have you here. And to schedule an appointment, you can call 413-732-7426 or visit entsurgeons.us for more information.